So, what if you could take centuries of traditional healing knowledge and not just preserve it, but actually supercharge it with modern science? Today, we're going to dive into a powerful new model for doing just that, creating amazing health products from medicinal plants. It's a model so promising, it was submitted for the prestigious VAIGA 2026 Agricultural Seminar.
So where does this all come from? Well, we're breaking down the work of Dr. Jyolsna P from the Government Ayurveda College in Thiruvananthapuram. And listen, this isn't just some casual idea. It's a formal proposal for a major seminar, which means it's a serious, professional framework for the future of wellness.
Okay, so before we get into the nuts and bolts of the model itself, you really got to understand the foundation it's built on. Because something this innovative doesn't just pop up out of thin air, right? It's rooted in a deep, deep legacy of healing expertise.
We're talking about the Government Ayurveda College in Thiruvananthapuram. This place has been around for over 100 years. Think about that for a second. That's more than a century of deep knowledge and hands-on experience in Ayurvedic healthcare. That's the kind of credibility that's backing this whole thing.
And it's not just that they've been around forever. This college is a total powerhouse. I mean, they're not just good at one thing. They excel across the board: education, clinical services, cutting-edge research, and even community health. It's this whole ecosystem, this complete package that creates the perfect launch pad for Dr. Jyolsna's model.
So the big question is, how do you take all that history and expertise and turn it into something new? Well, it all boils down to Dr. Jyolsna's core strategy. She's built this on two powerful pillars: deep academic research on one side and real-world community needs on the other. And the key is, she doesn't treat them like separate things. She weaves them together.
And this is where it gets really cool. It's not just a lab coat and a tower handing down information. Look at this. On one hand, you've got serious academic street cred. We're talking published research papers, innovation programs, invited talks. But then, on the other hand, all that brain power is directly applied in the community. Things like occupational and school health programs, medical camps. The two sides are constantly talking to each other, creating this amazing, powerful cycle.
And that cycle creates what we call a reinforcing feedback loop. It's so smart. It starts with a real-world problem in the community. Then, that problem drives the research to find a scientifically backed solution. Once they have answers, they go back to the community with education and outreach. And here's the best part: they measure the results, see what's working, and use that data to refine the entire process. It's like a living, breathing system that just keeps getting better.
All right, so we've got the legacy and we've got this awesome feedback loop. What happens when you put them together? Well, you get something you can actually hold in your hand. This is where the plant literally becomes the product.
These are what Dr. Jyolsna calls value-added products. And that term is perfect, because we're not just talking about grinding up some herbs here. This is about taking amazing local plants from Kerala, validating their traditional uses with hard science, and then transforming them into modern, safe, effective products like nutraceuticals and cosmetics that are ready for the market.
Let's look at a real-world example. Turmeric, right? Everybody knows turmeric. It's a staple in Kerala, and for ages, people have known it helps with inflammation. Well, this model takes that traditional wisdom, proves it in a lab, and then develops a standardized nutraceutical from it. So now, it's not just a spice in your kitchen, it's a targeted, science-backed solution for a major health problem like chronic inflammation.
And it's not just for things you ingest either. This model is super versatile. Think about something like the hibiscus flower. Its benefits for hair and skin are studied, validated, and then boom! That research leads straight to creating natural, effective cosmetic formulas. It's a perfect example of blending ancient beauty secrets with modern skincare science.
And what's so important to remember is that these products aren't just made for the sake of it. They have very specific, targeted goals. We're talking about boosting immunity across the whole community, reducing inflammation, improving skin health, but it goes even further. It also helps create sustainable jobs for local farmers who grow these plants. It's this kind of innovation that really lifts everybody up.
So when you step back and look at the whole picture, you realize this isn't just one successful local project. What we're really looking at is a blueprint, a model that could be scaled up and used to shape the future of healthcare, not just in Kerala, but everywhere.
And you know, this quote from Dr. Jyolsna really says it all. She talks about how systematic cultivation and these value-added products all work together. It's not just about making things to sell. It's about creating this complete, holistic system where preventive health, innovation, and sustainable development all feed into each other.
So where do we go from here? Well, the first step is a policy brief. To really make this model fly, you need government buy-in. We need more official support for these kinds of integrated research programs, programs that connect the dots between the universities, the community, and the local economy.
And second, this is basically a direct pitch to industry. There's a huge opportunity here, a really powerful business case. For any company looking to innovate, investing in this model means you get to develop unique products that are scientifically proven, ethically sourced, and tap right into that booming global market for natural wellness. It's a win-win.
Which brings us to one final, really important question. We've seen the model. We know it works. It combines this incredible legacy with modern research and real community care. So the question for all of us, for policymakers, for business leaders, for all of us is, what will it take to invest today to make this integrated model the standard for tomorrow's healthcare?